Welcome, everyone. Thank you so much for joining us. We're going to hold on just a minute while our platform is letting everyone in. You'll notice as you're entering that your camera is automatically off, your mics are muted, and that's how our participants will stay today. But we encourage you to use the chat. So as you're joining us and we're giving our platform a little bit of time, feel free to go to the chat, give us a greeting, let us know where you're tuning in from and where you're joining us, and we would love to hear from you. Welcome, welcome. I see our numbers growing. Hi, everyone. We'll be started shortly here. Feel free to use the chat to give us a greeting. Let us know where you're joining us from. I see some of those coming in. How wonderful. Oh, perfect. We have people from all coasts. All right. Well, I'm going to go ahead and get us started today. Feel free to continue using the chat and sending those greetings as we do our introductions. But thank you for joining us and welcome to today's webinar, Community Support, Finding Connection in New Spaces. My name is Jackie Zimmerman. I'm the Mental Health Public Education Associate at Mental Health America's National Office, and I'll be moderating today's panel. Just a few notes before I introduce our speakers. This webinar is being recorded and will be available to anyone who registered within 1 week. We currently do not offer CEUs, but if you would like a certificate of attendance, we do have a form that you can fill out to request one of those, and I'll post the link to that in the chat here shortly. That will also be included in your follow-up email if you don't grab it from the chat today. We want to say Happy Mental Health Awareness Month. As you can tell by our backgrounds, if you haven't learned yet, May is Mental Health Awareness Month. And at MHA, we are encouraging you to take a look at your surroundings and all of the things that are impacting your mental health in a variety of ways. And really this week of the month, we're focused on community and community spaces and how that has an impact on our physical and mental health. And today we'll be kind of diving into this discussion of how to find places within your communities to seek support that might not be those traditional spaces that we think of, like a clinician's office or therapy, but there are so many different community spaces that are providing support, education, and mental health help in your communities. And so we're going to have a lovely discussion about that today with our fantastic panelists, who I would love to introduce. First with us today, we have Sharita Sim, who is the Community Wellness Program Manager at the New York Public Library. Sharita is a social worker and community health advocate who's passionate about community health and wellness. Growing up in a rural area of the Deep South, her passion stems from her father, who dealt with substance abuse and addiction, and her family had to utilize community resources. Sharita loves working at the library because she gets to make a greater impact on the surrounding communities. Welcome, Sharita.
Hello, everyone. Thank you, Jackie.
Wonderful. With us today, we also have Anthony Sartori, who's the Executive Director and founder of Evolving Minds, founded in March 2020 as a mental health nonprofit with a mission to create a culture of care. Anthony is currently a professional speaker with Active Minds, sits on the Diversity, Equity, Inclusion, and Accessibility Commission and Board of Directors for Inward Bound Mindfulness Education, and is a founding equity team member at Vitalize Care, a Y Combinator-backed startup, where he designed one of the largest healthcare-specific mindfulness learning curriculum in the digital mental health space. Welcome, Anthony.
Hey, everyone.
And we also with us have Sarah Johnson, who is a community-engaged artist, licensed mental health professional, and human with many years of experience in prevention, mental health, art, and community building. She's founded Joy Labs LLC in 2021 and is working to build healthier and more equitable communities. Welcome, Sarah.
Thanks, Jackie. So honored to be here with this panel.
And last but not least, we also have with us Darnell Rice, who is the Chief of Membership and Engagement Officer for the Confess Project of America, where he is dedicated to raising mental health awareness for Black men and boys. Darnell is a mental health and disability rights advocate and is very passionate about social justice and mental health awareness. He's the founder and chief empowerment officer of Embrace Elevate, which is an initiative that targets Black men and boys who have survived sexual trauma, educates and raises awareness about abuse and neglect, and discusses consent and unhealthy relationships. Welcome, Darnell. We are so pleased to have you here.
I'm glad to be here. Hi, guys.
Awesome. Well, thank you, panelists. Thank you all for being here and sharing this space for the next hour. Obviously, from all of those bios, we have some incredible individuals here with varying backgrounds, and both personally and professionally. So I'd love for our conversation today to really just start by hearing a little bit more from each of you about the different settings that you work in that are providing supportive spaces, encouraging people to talk about their mental health within our communities.
Well, I'll start. So I work at the New York Public Library, who has 92 locations. We have 89 community branches and 3 research centers. We pride ourselves on providing essential access to books, information, and other services. We've been in business for over a century. We service Manhattan, the Bronx, and Staten Island. We're a public institution, which means that everyone is welcome. So we provide free and open access to all of our materials. And because our patron population varies from borough to borough, making our patrons feel welcome means recruiting and maintaining a diverse staff. I mean, celebrating cultural diversity by partnering with community voices and local businesses. And it also means reducing the stigma, right, around mental health and other topics by providing safe spaces to speak on these topics through programs and our services that we offer.
So I'll jump in. So I work for the Confess Project of America, and we specifically train barbers, stylists, and beauty professionals of how to be mental health advocates to, end the stigma around mental illness, because we know how pivotal the barbershop is in our communities. Everybody has either a barber or a stylist, and typically that's the closest thing that clients will get to a therapist through their barber and stylist, because they're trusted individuals. We can go as far as back as the civil rights era. Our leaders strategize in the barbershop, and the barbershop industry is one of the oldest industries in the world. So we want to make sure that we continue to provide the safe spaces for our barbers and our stylists and our clients that come in and out the barbershop every day, because the barbers and stylists are very essential in our communities. They're trusted. They make you feel good, look good, but they also are confidants. They're not clinicians, but they're advocates. And it's so important that we continue to have this brave space in the barbershop and the beauty salons. And so we typically at the Confess Project, what we do, we train them on 4 principles: active listening, positive communication, validation, and reducing mental health stigma. We have trained over 2,800 barbers, and we're in 52 cities within 29 states. Our national office is in Atlanta, Georgia, and we have a satellite office in LA, and we're about to branch out to Boston, Massachusetts. So yeah, that's just a little bit about what we do. And so we garner the support of community like-minded organizations, and Andis and Gillette is one of our biggest corporate sponsors because they believe in our work.
I don't know, Darnell. I wouldn't say that they aren't clinicians, right? I think that as we're talking today, we need to really rethink what a clinician is, because I definitely have worked some things out sitting in a stylish chair, even if it's, an organic conversation that happens with just the other people at the salon, right? So I don't know. I think maybe they are. I would say maybe they're not medically trained or academically trained, but I would definitely say that they are. They have some level of clinician to them. Absolutely.
I mean, they do, but I'm saying on more of a aspect because you don't want to get into conversations with a clinician and say because they're typically, yes, I agree with you on that. They have some level of expertise, some level of of lived experiences. So, I mean, I can attest to that, but that's something that we would need to talk offline about.
I can jump in here. I think I love hearing what's happening in different communities. And I'm really excited to connect more with this panel and figure out how we can collectively like mental health revolutionize this whole thing, right? So I'm working in partnership with YMCA of the USA, developing a model of mental health community care that I think probably is really congruent, really aligned with what you're describing, Darnell. Basically, mental health community care is equipping everyone in our community with the simple skills that we can all learn to know how to care for ourselves and each other effectively. And Sharita, absolutely to your point, like community is medicine. We live the majority of our life in community. We all need to know how to take care of ourselves. Like when I'm struggling, I want to make sure I know that my friends and family know what to do. And I want that to be true for all of my neighbors and community members to know how to do those things. And when we think about mental health community care, we're talking about it in a couple of different ways. Formal supports are maybe what your, clinician is what we think of that word, but that's our like folks who are trained as psychologists and therapists, psychiatrists, our crisis workers, our folks who are answering the phone, right? There are formal supports. There are far less of them than there are us as informal supports. We're all informal supports to someone. So that's how I like to think about mental health community care is just a set of skills that we can teach to and learn, practice, and then it's a culture shift.
My focus is workplace mental health, and the settings that I work in are nonprofits, social impact organizations, working with educators, but also retail workers, grocery store, cafe, restaurant. And over the past 2.5 years, I worked in a grocery store as I was building Evolving Minds. And what I saw was a great need for social support, but also to disrupt a lot of workplace conditions that were causing workers harm. So my main focus in the work that I do is how do we redesign and reimagine workplaces and work systems to be supportive of mental health and well-being, to be engines of belonging and not despair.
Thanks, Anthony. And, oh, Sarah, did you want to add
I,
something? Go ahead.
I love that. Anthony, you're speaking my language. I start getting extra dorky and like about this stuff when I think like, what if on your worst day, you were in the vegetable aisle and you pick up a parsnip and you just like, you lose it. And what if the person who was stocking the shelves noticed and said, hey, how are you? Are you okay? And the person shopping behind you, like, can you imagine if we all knew how to do that? And not only that we normalize help seeking, but we normalize help giving. Ooh, it just gets me excited.
Those are so great. I love getting to hear how each of you are essentially doing very similar work in very different community spaces. And that's really what today in this discussion is all about, is that everyone who's joining, no matter if you're a community member, if you are a clinician, if you're someone working in a mental health nonprofit, if you're a teacher, no matter what your occupation is or your profession, you're still joining as someone who lives as a part of a community and can provide support in different ways. And it might be through your organization or profession where you're working, but it might also just be in your daily life. And I think that's what each of you has highlighted so wonderfully, is how anyone can really be a support and provide support. And so I'd love to touch on more on that and how we can use community care to provide additional support to individuals. As we know, access to clinical mental health care, the things that, Sarah discussed as those formal supports, the psychologists, psychiatrists, counselors, that can be incredibly difficult for people to access. And even for those that are able to access it, sometimes, that's not enough. And usually that's not. We need other support in our life from different areas. So I'd just love to hear from you about how community care can provide that additional support to individuals who might be struggling.
I can definitely chime into that. I really feel and I really see in the work that we're doing with barbers, stylists, and beauty professionals, we really got to take a hard look at how we access these different mental health services in communities of color, because there's not a lot of access. But when you equip the corporate spaces, equip the barber, stylists, and beauty professionals coming together to say, hey, we have a state of emergency. See, when you think about mental health access and mental health illness, when you think about it, it's a global problem. It's not just a community problem. And I feel like when we do that, when we say, hey, this is a state of emergency, and we start to get into policies, we start to get into legislation, that's where it starts. We have to make sure, we have to be allowed to say, hey, there is a need, there is a need and issues that we need to combat. But it starts with legislation. I strongly believe that we all can come together and and put everybody in the room and say, hey, we need solutions.
Yeah, absolutely, Darnell. We definitely need more, as Sarah mentioned, we definitely need more formal staff, right? We definitely need more programs. We definitely need more funding around mental health. In addition to that, I think that there are still some things that we can do, right, in the meantime. So some things that we do at the library, of course, is we offer a range of resources. So we have a huge circulating collection on self-care books, on meditation, on homeopathic methods, information on mental health and resources. We also offer health databases. We do programs. And again, all of these things are free and open to the public. And we're not just doing it for our customer facing, right? We also provide staff trainings on reframing homelessness and making sure that we're looking at the individual first and not necessarily the situation or the circumstance, right? We're providing them with tips and tools and strategies and things that they can do when they encounter someone who may be experiencing a mental crisis, or even giving them what a mental crisis may look like, right? Because when you are a clinician, you do understand that there are some prescriptions that also may mirror, right, a delusion or a psychotic episode. So we want to make sure that we're not labeling individuals. We do all types of events, but I think in addition to that, one thing that we can do is we can have programs like this, right, where we come together collectively, and it's a community, and we're all talking about, here's what I'm doing, here's what I'm seeing, and we can, learn and grow from one another.
Definitely, Sharita. That's definitely a great point. And also, just utilizing those community organizations too, to say, hey, let's partner together, let's collaborate, because I believe it takes all of us. But a lot of times, when people sometimes don't feel that it is a need because of certain situations. When you think about mental health, I have lived experiences. So, for me, having those lived experiences and still living beyond my lived experiences speaks volumes, because that makes me an expert because of living through it and being a testament and being a testimony to hear, because it's a ministry. I feel like what we all are doing is ministry work, and it's purposeful work. So, definitely utilizing those individuals, organizations, and just growing. Like you said, I love that. We need to grow.
I love that. I love that so much, Darnell. I totally agree that this is having those conversations everywhere. And one of the things that you said several times initially, Darnell, is just that the importance of trust. And, when we think about accessibility, we're never going to have enough mental health professionals. We're just not. It's just, even if we could suddenly train everybody right now to do that, like it's years of training, and we won't have enough people. But we also, mental health is not just influenced by our experiences, but are the things that shape our health, like access to healthy community and a safe neighborhood, access to good education, access to the food, the kinds of food that can help us fuel our brains and bodies so that we can be healthy. So when I think about what you're doing, Sharita, with the library, I think that's so, it makes so much sense because people access the library, people access their barber, their stylist, right? Like we're taking a whole barrier out of there by really equipping people with those skills.
Yeah, and it's about, highlighting those community stories, right? Those community conversations, and going to the rec centers, going to the parks, and or the PTA meetings, right? And making your voice heard and making your voice known, letting individuals know, hey, you know, this is what we're seeing. This is what we want. How can we get behind this? What can we do as a community and come together and collectively, do something that will allow legislation to come about, right? We have to first say that there is a problem and that we are willing to put in the work behind the issue, and that we're not just, waiting on legislation because like Sarah said, that could take years, right? To get the people, to get the money, to, get the bill, that could take years. In the meantime, people are suffering. So, what can we do in the meantime? And I think highlighting those community stories and those community conversations is definitely a good way to start.
And also having like you said, legislations, but also having your community aldermen, your councilmen to say, hey, I buy in. That's how we're able to grow and be in 52 cities because of the presence of, city and state officials that are really in the mental health movement. I saw in the comments about grassroots organizations. We meet people where they are. And that's the thing. We got to get back to community, really reaching out to the community and really, letting their voice be heard, because testimonials are great, especially when people have been impacted by organizations or just by stories of saving a life. Because when you think about the barbershop and the salon and the beauty industry, you have barbers and stylists that stand behind the chair. That's their pulpit. That's their message. That's where they give messages out to the community. Believe it or not, I'm thinking about the movie Barbershop, and there was a part where a young man was about to throw a mocktail against throw it against the barbershop, and the glass was shattered. But they said no, this barbershop is very sacred. So if we would really start treating the barbershop and the beauty salon as a social hospital, to where we're able to garner and say, hey, have a clinic in a barbershop, to where you have, those different conversations, but have those services in the barbershop. What if we had therapy in a barbershop? What if we had, a clinic that did screenings? That would be very powerful.
I want to add, when I'm talking about mental health community care and the work that we're developing at the Y, we're really looking at how can we, the Y being an example of a place where community gathers, just like a library, like a barbershop and stylist shop. How can we get that information where people are so that we can be promoting mental health? So both normalizing those conversations, that those are happening, and also helping people develop those skills to recognize what helps support my mental health, what helps me feel healthy, what how can I tell when I'm not doing well, and what are my tools for managing that? When do I recognize, oh, I might need to seek out formal support? How can I recognize that in others? How can I respond, right? So in really what we're working on is creating that culture. And I saw in the chat somebody had kind of mentioned culture change can help shift our systems change, which is a really essential part of this. Is we need to show up differently for each other and ourselves. And that means being more proactive rather than reactive with our own mental health and that of our community members. Really focusing on trying to reduce the risk and impact of mental illness, trying to prevent, get early intervention so that we can really free up our formal supports to do the work with folks who absolutely need that, and really helping increase the capacity of all of the rest of us in community to, again, effectively care for ourselves and each other and support in peers, right, with the folks we trust.
And also, when you talk about that, Ms. Sarah, I think about, you know, the communities that I serve and that I live where I serve. So, you know, when you don't have clinicians that look like myself, then that's where, you know, when you talk about the 2% of psychiatrists and 2% of psychologists are not people of color, that's a concern. So that's why barber shops, beauty salons, and those professionals are so key in the community, because they are trusted. They're trusted. They're, you know, garnered for information. You know, they make us look good, feel good. But I mean, when I tell you, a lot of barbers and stylists, they get dumped on every single day. So we make sure that the barbers and stylists and the beauty professionals have those resources as well. It's just not for the client, it's for them as well, because we know life can happen, you know. So I really love that, you know, your point too. I think we just gotta be honest and real with ourselves and understand that, hey, you know, being a black man, we typically didn't have these conversations, you know, going to a therapist, because we thought about the guilt, the shame, and everything with, you know, just talking about it, because we didn't want to feel like we were weak. So that's why it's important that we have the barbershop and the beauty salons as a way to have a voice and to feel appreciated and say, hey, you know, I can be vulnerable with my barber and stylist, because I know that they're not going to judge me. They're going to help me see the best version of me and be the best version of myself.
Thanks, Darnell. Any last thoughts on that before I pivot us a little bit? No. All right. Well, thank you all for that great conversation. So many good points brought up, and one that I kind of want to lean into next that a few of you had mentioned is just the importance of having these conversations, storytelling. And I think that storytelling can be so powerful when it comes to mental health. And knowing that someone else is also going through what you might be going through, or that you're not alone, can just be a message that can be powerful in itself, and start to chip away at that stigma that our society has put up around talking about mental health. And I know that sharing stories and sharing lived experience can help kind of take a stab at that. And when we're thinking about our community settings too, and being able to share with others, provide that connection, and be that support, those are important stories to share of how this community support is engaging individuals and is providing really valuable support that might be just as valuable for some people as clinical support. So I'd love to open up this space a little bit today to talk about, you know, how you have seen the impact of bringing mental health work into the community impact individuals that you've worked with or that your organization has worked with. And, really just in your respective areas, I know people were already posting comments in the chat of, restaurants or bars and all of these other places. It might be a gym, it might be somewhere where you're working out that you feel safe to confide in someone. And so I just love to hear from each of you kind of how you've seen the impact of having conversations about mental health in everyday spaces, how that's impacted those that you work with.
Yeah, so what I'll say is, so throughout the pandemic, prior to us closing, we were still providing services, right? Because we were seen as essential to the community, and we are. So one thing that we did do is we saw that there was a need definitely in our African American Latinx community during the COVID pandemic, because they were the communities that were affected the most by the numbers and everything that was happening, due to a lot of mistrust, right, from the healthcare community surrounding the vaccine and all of that, just based on history, right? So what we did was we partnered with the psychiatry department at Columbia University and Black Health Network, and we came together and we said, hey, this is what we're seeing in our community, and how can we help? So we put together a full page resources, which I shared with Jackie, and she will share with each and every one of you, that is equipped with book list. It is also has 10 short animated videos that range anywhere from talking to your teen to speaking to an older adult who may be experiencing isolation, and they're now trying to get reacclimated back into the community, to wellness videos and a lot of tips and tricks. There's Darnell mentioned about finding a therapist that looks like you, right? So there's there's a link to therapy for Black girls. There's all different sorts of information on this one page that we have on our website, nypl.org, so that you can go to and get all of these resources in one place. And I think that that's a way, again, because the animated videos kind of walks you through just a casual conversation. So there's something that you can get from that. There's some of them take place at parks. Some of them take place at doctor's office, right, where people are already having everyday conversation. And then, of course, there's books there. And then if you're just looking for yourself, then there's resources and links for you to find a resource that's going to fit you. So I think that that's how we've been able to see the stories come to fruition, because we saw a need and we were able to meet it by partnering, like I said, with those trusted voices in the community and providing that service to our patrons. And of course, free. So it's not just available to individuals that have a library card, right? It's on our public facing website, which means it's really open for everyone.
Love to jump in and share a brief story. Yesterday, with my mom and my dad, we were sitting in the backyard, and it took me almost 3 years to work up the courage to practice gratitude with my parents. And it's a skill that we teach in our programs, and I'll just kind of showcase what it looked like, because it's very practical, and everyone in this space could do this tonight or tomorrow. The question was, what are you grateful for? So I asked my mom and my dad and me, what are we grateful for? And I had a stress ball. Sometimes I bring in an imaginary ball because, it's playfulness and creativity, and you can throw around the imaginary ball, but wasn't starting that with my parents just yet. Maybe we'll get to the imaginary ball in the future. But what are you grateful for? I set a timer for 20 minutes, and the stress ball just moved around from one person to the next, and we just shared gratitude. And in my entire life of 27 years, I have never seen my parents either process or share the stories that they did in the way that they did in just 20 minutes. My mom talked about her struggles with her parents. You know, mental health has been a big part of my personal life, my mom's life. She's battled depression her whole life. She lost a sister to who battled symptoms of schizophrenia and who was homeless for a long time. And while we were just sitting in the backyard, I was able to hear and share these stories with each other. And I left feeling connected. I left feeling energized. I left feeling like, wow, I love my parents. Of course, you know, there's stress and there's, you know, we all know family. But I was able to feel a sense of positive connection with them. And I also was aware that they felt very similarly. So just a very practical real world example of one skill, 20 minutes with family, and just can have a really transformative impact.
Yeah, I like that, Anthony. I was thinking about doing that with my organization. I think, you know, we could definitely institute that into the organizations that we work in, because that'll be a sense of community. And to your point, as far as your parents, man, that's beautiful. With sharing that gratitude, you know, and I think a lot of times just being grateful for the work and for the communities that we serve is so powerful. And just really understanding that, you know, gratitude will go a long way. Um, and you know, and it's just we just need to get to that point too as well, to just show gratitude. I mean, it doesn't take long to be grateful, but when you start talking about gratefulness, it's just much deeper than just being grateful for the now.
This is all so gorgeous, and I'm just so I keep getting excited and getting ahead of myself. But you know, I think what I'm hearing all three of the panelists say really loudly and clearly, and I 100% agree with, is community is medicine. We know that we can't talk about trauma and adversity without also talking about resilience. Resilience is built through connection with ourselves, like our sense of ancestry, our sense of strengths, our interests, our dreams, all of that stuff, our connection with our community, and then our connection with these vital skills that we can learn through coaching, right? This is what Anthony's working on, coaching mindfulness and building that workplace culture. This is what we're building at the Y as well. Like, how do we get this out in the community? And then you're living it, Darnell and Shrita, at your locations. Like, you have people showing up and sharing their lived experience, sharing their empathy, sharing their sense of community with each other. That's how we learn that stuff. Even better if we can be strategic in how we teach it, right? That's what I'm working on. But just by living it, you are role modeling, you're showing. And a really simple skill that I think is really foundational when you ask about impact, Jackie, one of the things that has been most impactful is one of the most simple things I think I've ever taught anyone at pretty much everywhere I go, when I say, how are you, but mean it, and actually answer the question honestly. That is like mind-blowing for people to be like, oh wait, I don't just say fine and then leave it. No, like let's have that conversation. That's an invitation to talk about mental health. It's just how you think, feel, and act. We all have it. Let's check in.
Yeah, also we do so at my career, my purpose driven career. What we do is anytime we start a meeting, we say, hey, what is your scale of 1 to 10? How are you feeling? Between 7 and 10 means you're doing well. But if you're under like a 6 or a 5, you may need to reach out to your support system. And we also do mental health days every month too for the organization. And we do have a therapist that's on staff for the organization too as well, for the staff members, because we have life that happens as well too. especially, doing the work that we do in our communities.
I love those. And those are three just such tangible things that people listening can take from this of, that time and gratitude, those intentional, how are you type of conversation, and those intentional check-ins like Darnell had mentioned. And then I like what you said, Darnell, about if they're a 7 or above, there's follow-up. And I think that's such a key part of all of this is when we are providing support and care in the community, it doesn't just look like asking the questions and being the listening ear, but how do we then follow up and support and equip individuals to provide that support or to answer, to lead someone to someone that can provide that support, which is such an important thing. I love all of those examples you've given. I'd love to dig a little deeper into that for everyone who's listening. I know at the beginning of this call, I had mentioned how we're all community members, and we all have a role in this providing and receiving support. And so for everyone who's listening, panelists, what advice would you give, or what other recommendations can you provide today for how to be more intentional about giving and receiving that support? Or if you have any other tips and tricks like the ones you've already shared, which were so great.
I would say by normalizing it, definitely, we all have bad days, right? Where we don't feel like doing or being. And sometimes it really is just a feat to get out of bed. And I think the more that we normalize it, the more we talk about it, the easier it'll become. Just like Darnell said at his company, NYPL also provides mental health days for its staff. These are days in addition to our paid time off, our sick leave, or our family leave, right? These are just days for you. So I think by normalizing it at the business level, it makes it easier for us to incorporate it into our family life and then in turn to our community, because most of us spend majority of our days working, whether we're working for ourselves or we're working, at an organization, or we're traveling to work, or we're coming from work, right? We spend most of our time work related. So I think by normalizing it at that level, saying it's okay if you just need a mental health day, or if you're at a 7, 8, or 9, we're going to follow up with you, right? Or we're going to do the check-in, like Sarah's saying, and we're going to stop and pause and give you an opportunity to listen. And we're going to actively listen to what you say to that, right? And then we'll follow up based on, I think, by us doing simple things, right? Just simple shifts, simple changes, I think can make such a huge difference in how we view mental health, in how we talk about mental health, and how we address it.
I love that, Sharita. So I'm gonna definitely do this. So when you think about mental health and you think about mental health advocacy, being vulnerable is a new sexy. And a lot of times we got to make sure that we, like you said, normalize the conversation, but like you said, really care about the conversation and really understand that, hey, my fellow colleague or my fellow peer or even church member or my friend is really having some concerns right now. Because guys, I don't wake up at a 10 every day. And I'm just going to be perfectly honest with you. But I gauge it at where, I understand, have the awareness of where I am emotionally and say, hey, I'm going to work up to a 10. I'm going to work up to, to being the best version of myself, but also understanding that reaching out to, the resources that are readily available, because believe it or not, guys, I use the resources as well for myself. Like you said, coaching, praying about it. That's good. I'm a firm believer in praying about it. But when you have other entities that are around you, other resources that are there to help you be the best version of yourself, then you can say, you know what, I have a village, because it takes a village for everybody to feel good, look good, but be appreciated. Because at the end of the day, y'all, we have trauma that we need to heal from, whether it's family trauma, whether it's racial trauma. I can go on and on.
Yes. Oh, yes, that just really spoke to me. And I would add, so yes, 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 yes to everything I just heard. And I would add, so I kind of think about me and the work that I do in two realms, and lots of times they overlap. One realm is this public health world where I'm using my mental health training to be developing trainings and working with people on developing their skills. The other is me as an artist and as a community engaged artist. So bringing community together to do art and be creative and solve problems and build those relationships so that we can have culture change. And so, to answer your question of the how, another how is just to get people together in community, like even just around some hot dogs, right? Like shout out to my local library who's doing great work in supporting mental health in the community in these informal ways. We're going to do Pride in the Park tie-dye with teens this summer, right? So just doing things that build a sense of identity and a connection to each other and that are just fun, that in and of itself is helpful. And I think about myself with my own experience of trauma and resilience. Key to my resilience, yes, has been some therapy, but a lot of it, pretty much all my trauma, has come through my art. And that's the stuff that is the truly deeply healing stuff. And that community piece of sharing that experience with others who then go, oh, I see myself in that. And so, yeah, just opportunities to connect. I think we're hungry, especially in this era of massive social isolation, increased loneliness and disconnection. Let's just be together.
I have a quote here for connection that I'll share, bounce off that share, by Dr. Vivek Murthy, U.S. Surgeon General, just released the Our Epidemic of Loneliness and Isolation report. Social connection is a fundamental human need, as essential to survival as food, water, and shelter. Just taking a moment to let that sink in. Social connection is a fundamental human need. So when I hear this question posed to us, I think that any person that I'm going to meet in the interaction that I potentially have with them can have a deep impact, especially knowing that half of adults in the US experience loneliness, and that was before the pandemic. So you can imagine where we are now as a society and how important just connecting with the people around you can be.
Thank you, Anthony. Quote encompasses so much of our conversation today and really does a great job of highlighting the necessity of community and just the great impact it can have on individuals. So I just am in awe of all of the work and knowledge that you all are bringing to this conversation and sharing. So thank you all for your extremely thoughtful responses. I know we're getting close to our hour, but we have a little bit more time. I'd love to sneak in some more discussion before we wrap up. I would love to talk about, we've discussed how, Darnell, you're working in barbershops, and Sarah, you're in community spaces. You're doing artwork in all sorts of different things in workplace and in colleges and then in grocery stores and retail and in the library. I mean, there's so many community spaces that even just the four of you represent, but there is a plethora of, I'm looking outside my window right now and there's like 7 different buildings I can see that all represent a different something. And so for everyone who's listening, And when we're talking about creating these type of spaces where people feel comfortable sharing and asking, how are you? Or sharing gratitude, or, Darnell, scaling of how you're feeling today. I think there's a whole side of creating a space where people feel comfortable even doing that. So, what in your mind, and in your experience working in these community spaces, how have you really created that culture within these community spaces that makes people feel comfortable asking for help or sharing or saying when someone says, how are you? Actually, not too well today, because that can be hard in itself. And so when we're thinking about community spaces from the side where someone might be sitting here as a business or someone leading a community space, what kind of thought can they bring behind the space that they're creating to make it feel safe and comfortable to bring these conversations really into the light?
Definitely using stories, because storytelling is a great way to connect with individuals, but really being transparent and really being honest and open and letting them know that you're not alone, and really understanding that, hey, I suffer too. Because when you think about stories, and you think about lived experiences, when we go into barbershops and go into beauty salons, I don't go in a three-piece suit. I go in my J's and a jersey and a snapback. And I'm connecting with my community because they look like me, but I'm letting them know, hey, I've had my lived experiences too. And when you can be relatable and be honest, that is so powerful. And then that's when you can really start the healing process. So, just really having that intentionality and really being open with yourself and with individuals in those spaces, because they're going to see your heart. They're going to see you because they see themselves.
And I think, in addition to what Darnell is talking about, right, this modeling of the behavior that you want to see, right, making sure that you're meeting people where they are, partnering with those local staples, right, like your local barbershop or your local faith organization, right, where, going where those stakeholders are, where you don't have to necessarily do the messaging, you don't have to change the message, right? You can use, like Darnell is saying, those stories from those community leaders, from those community voices that already have a way to reach the masses, right? They have a way to move and shape. So as long as you are partnering with those individuals, being authentic, being transparent, modeling the behavior, right? Then really all you got to do is show up, right? All you got to do is show up and say, hey, I want to partner with you. I see what you all are doing. Have you thought about, here's something we can bring to the table, and I was in the chat talking to a fellow library worker and just talking to them about how sometimes libraries are seen as not safe places, right? Because people have a different perception of what their library should look like, so I think by us modeling the behavior and utilizing those community stories and highlighting those community voices that represent what we want to be represented within our culture, within our organizations, is definitely a way for us to make sure that we are engaging with the community and they in turn engage with us.
For the workplace, to create a culture of where people feel comfortable asking for help, we have to actively disrupt harmful workplace conditions, because work was not made for our well-being or our mental health, our work systems, our policies. And so part of my path and part of my role has been, how do we create spaces that view people first, planet first, over the history of labor in this country, which is productivity and profit. So the spaces that we're in are not made for our mental health or well-being, and we must advocate for change. And that's part of my work, but I think it's part of all of our work, because on average, US adults spend, and this is a Mental Health of America statistic, 8.8 hours a day at work. So we're at work all day. And can we push back and say, no, I actually need this, this, and this to thrive and to be comfortable to ask for help and feel a sense of belonging.
Definitely want to add to Anthony what you said. So I'm the culture guy in the organization as well too, and we thrive on people-centered leadership. We thrive on being people first, and it's so important to change the culture in an organization. Think about this. Think about if your large corporate organizations would take a person-centered approach and be able to create that person-centered environment. You would have less turnover, and you would have high productivity. So that's what we're positive disruptors. That's who we are, and that's what we do. We're positive disruptors. So we just got to be those disruptors for change. And sometimes change is not easy. Change is not easy, but change will come. We just got to continue to be on the positive disruptors spectrum.
Yes. I hear the word transparency and following through. Like, this is about showing up. This is about showing up and continuing to show up. And I like to think about, like, I want to know that not only do people, like, not only am I seeing you, the person in front of me, I want to know that you see me seeing you, that you feel that sense of connection, that sense of belonging. And that might mean I need to keep showing up. I need to, keep that door open until I've demonstrated adequately that I am trustworthy and that I'm going to continue to do this work, that I'm going to continue to show up. So I'm just going to keep smiling over here. The power of this conversation.
Yes, I'm in the same boat. I know we're close to the end of our hour, and just what a rich discussion, and so many great and important points were brought up that I just want to be able to broadcast to the world after this conversation. But I just want to thank all of our panelists for being here today, and for the work that each of you are doing in your communities, and continuing to provide this support and community care within your own communities. And by being here and sharing it, it's continuing to spread. And that brings me to thanking everyone who has joined us here today for asking your questions, making your comments, connecting in the chat. We really appreciate you, and challenge you, this May being Mental Health Month, to really think about, how can I be that support in my community, in my workplace, in my family, in my relationships outside of that? At the grocery store, if someone's having trouble, if I'm at the barber shop and I see someone looking down, or if I'm at the library, there are so many spaces that you can think about being more intentional about providing and receiving that support. So just challenging everyone this May, bring it to the forefront of your mind when you're in those community spaces, and see what an impact it can make in your life and in other people's lives, and continuing to do so. So I just want to thank everyone for being here for this great hour. A reminder to everyone who's joined us, the discussion today was recorded and will be sent out to you within a week, along with some resources provided by our speakers that were discussed today. So keep an eye on your emails for those. And thank you all so much. Thank you, panelists. We are so grateful that you were able to share this space with us at MHA.
Thank you.
Thanks, everybody.
Thank you
everybody.
all. Have a good day.
Take care.
All right. Thank you, everyone. Have a wonderful rest of your day, week, and May Mental Health Month.